No, hypertension, it's known as a silent killer. So it's very difficult to try to treat and get under control. Um, Hypertension affects the African American community at a much greater rate and at an earlier onset. So it's difficult, and a lot of patients don't even realize that they do have the illness, hypertension. So it's hard to sometimes convince people to take medication because they have an illness that's silent, that it doesn't really manifest itself until later on. And then when it manifests itself in a really significant manner. So they're at increased risk for heart attacks, increased risk for stroke, and overall increased risk of death. So in order to, you have to kind of keep those things in mind and help patients to understand that even though they may not be experiencing symptoms that they can identify at this time, that it's still really important to be compliant with medication and also to make necessary lifestyle adjustment changes. So things like reducing weight, not smoking, limiting alcohol use, increasing activity, eating a healthy diet. And then also we want to encourage people to know about their health, know what your blood pressure is, know what your cholesterol levels are, know if you're diabetic and are you controlled or not controlled. So it's important for people to have a knowledge about what's happening internally in their bodies and living as healthy a life as possible.
Right, and I think you touched on a lot of really important aspects of health that all kind of drive back to the idea of health literacy, right? So people understanding how health works, like what they should be eating, how often they should be eating, exercise, and things like that. How do you alleviate those barriers? So when you meet a patient who just they may have a lapse in their personal health literacy, and that's the reason that they're falling on the wrong side of what we're looking for. How do you go about challenging those situations to help people grow and learn?
Well, we encourage people to come to their office visits because we have an opportunity there to do a little bit of education about what a healthy lifestyle looks like and the medications and what they are and what they need to be taking. So we try to do some educational component during the office visit itself. And we also have a lot of additional providers who can help give a more in-depth education on healthy lifestyle issues. And some of that happens through our wellness group, and we have several registered nutritionists, dietitians who can help patients with specific goals and specific information in regards to healthy eating and healthy lifestyle. We try to encourage patients to use their exercise bonuses if they have an insurance plan that allows for a reduction in the cost of gym membership. We try to encourage people to do things like that. We try to encourage patients to have increased activity. And then there was also a mobile market, which we had when weather was a little less inclement. During that time, fresh fruits and vegetables were available at low cost, and we definitely encourage patients to take advantage of that.